Hello everyone, this is Rebecca King with Northeast Tech, and I'm here with this phenomenal group called the Cherokee County Health Service Council, and they're going to share with you some of the awesome events that they have coming up, and I'm going to go ahead and turn it on over to them.
Hi, good morning. My name's Carey. I work with the Cherokee County Health Services Council, and I'm also the executive director of the Delaware County Community Partnership.
Good morning, my name is Marcus Buchanan. I am the program director for the SAMHSA FR-CARA grant there at Cherokee County Health Services Council.
Excellent, guys. So you have this event coming up September 16th, 17th, 18th, and 19th, and it's called Frontline Mental Health Summit. Could you tell me a little bit about that?
Absolutely, we are super excited. This is our first large summit that we're going to be organizing. We first talked about the organizing this as having a one-day multi-track health fair, summit, education seminar, and we came up with the crazy idea to make it 4 days, targeting each specific track, giving each profession their own day, bringing in speakers that are specifically for them. So from first responders, law enforcement officers, peer recovery support specialists, that's people who lived in recovery, who took the state's training to become a PRSS, as the state calls it. And then we have educators and medical professionals. So each day is going to be jam-packed with great speakers. Some of them are nationwide speakers that have real large names in their professions. And each day is also going to have its own specific hours, accreditation hour to come with it. So with law enforcement, they'll have their CLEAT hours. 6 total CLEAT hours is huge because a lot of these law enforcement officers sort of struggle to find those required hours to meet their CLEAT certification. And then with the peer recovery support specialist, they have the required ethics hours they have to have every year. And again, they kind of struggle to find those that are within driving distance or they can afford to get to. And some of them can be expensive to get to. And then we'll have the CMEs for the medical providers and the CEUs for educators. The event is in Tahlequah. However, we've opened it statewide because we want everybody to be able to come. Each day, there is only 240 chairs available. It's just the facility we have there at the Cherokee Casino in Tahlequah, the Chota Center. The venue only holds 240 people, so that's how many seats are available for those days, each day. So we've been promoting it statewide, hitting the ground running, the guerrilla marketing, going straight to the PDs, straight to the schools. Yeah, we're super excited about it. The registration fee is $50. That includes your entire day. That includes the hours that you're going to get for attending it. It also comes with breakfast. We're going to have a vendor fair, so come get your goodie bag. We're going to have giveaways, door prizes, everything. We're so excited.
That's awesome. And so this is going to be held in Tahlequah, right?
Yes, it is there at the Chota Center. That's just the Cherokee Casino there in Tahlequah.
Excellent, excellent. So food, get your CLEAT hours in. First responder hours too?
Yeah, the first responder is the CLEAT hours. Yeah.
Okay.
Yeah.
Excellent, excellent. Well, this is great. And so in addition to this, you also have options of grant funding to help offset some of this tuition?
Yes. The Delaware County R-Corp grant is actually part of Cherokee County Health Services Council, and we are offering several scholarships to go to the summit. We will pay your registration, your per diem, and mileage for the day. So if anybody's interested in that, get a hold of us. We need to know pretty quick if you need the scholarship, and we'd love to send you.
Excellent. How can they contact you about that?
They can reach me on either Facebook at the Delaware County Community Partnership Facebook, or at Lori at DCCPOK.org.
Excellent. Now, Lori, tell us a little bit about what you do.
Yes. So we actually have a Delaware County opioid grant, and we are going to be hosting an event this Saturday, August 23rd from 6 to 9 p.m. at the J Community Center. We will be showcasing a preview of a documentary we've been working on for the last year about addiction in Northeast Oklahoma. We've been doing interviews, and so we have interviewed people active in addiction, those in recovery, and family members that have been affected by addiction. So we're going to showcase that, preview for that. We're going to have a recovery resource fair. So all the resources in the area that, they're recovery based. We'll have raffle prizes, giveaways, kids games. It will be a kid oriented as well. Free hot dogs, hamburgers, snow cones, popcorn, cotton candy. It's going to be a great time. We're actually doing this in honor of International Overdose Awareness Day. So that will be this Saturday, August 23rd from 6 to 9 at the J Community Center, which is where the library is.
Excellent.
So we would love to have you all join us for that as well.
Excellent. So we've got a lot of stuff coming up this weekend in J, September 16th, 17th, 18th, and 19th in Tahlequah. And is there anything else that you guys want to talk to the public about? Because you guys got your hands in a lot of stuff.
Yes. My program specifically targets law enforcement, first responders, and Narcan training and Narcan saturation. So for the past 2 years, and then the continuing next 2 years, our main job is to get as much Narcan into the hands of community members as possible. Of course, Narcan is the opioid overdose antidote. That's what you give to individuals who are experiencing opioid overdose. So we've been doing that work all across Northeast Oklahoma as much as we possibly can. Any outreach event that allows us to come, we train individuals who stop by our table we talk to. We also have the only virtual reality first-person Narcan training in the country.
Oh wow!
It's fabulous.
A lot of virtual reality trainings is third person, like you're kind of like a fly on the wall watching someone else do it. With our software, you're the person doing it. You walk into an apartment room, you see a roommate, she is unconscious, and you have to go through all the steps to bring her back. And of course, we have the training teaching you how to do it up to that point, and then how to respond post overdose. So it's been a awesome resource for us, especially with the youth, to kind of, especially community members, not just the youth who may be scared about, what happens if I do, and it's just, I'm gonna panic, I'm not gonna be able to handle it. This gives them the closest thing they can to experiencing an overdose, and kind of lower their anxiety a little bit, and not be so scared and worried that they would be able to handle it and whatnot. And that's been our biggest project over the past several years, just education and distribution of Narcan. And we have given out thousands and thousands over the past few years. And I have watched the stigma reduce over time. When I first started with this work, the stigma was so thick and heavy. People would just shake their heads when they would see us giving it out. Like, why would you give that out? I can't believe it. And now people come to us asking us for it, saying, oh, that kit I got from you last summer saved my grandchild. That kit that this store gave to me that you gave. It's just, there's stories everywhere of people thanking us, or saying somebody knew somebody who used Narcan somewhere, and just appreciative of it, which is awesome to always hear, because it's not always been like that. There's been a lot of like I said, stigma about it. And towards stigma, I think the event this weekend is going to be awesome. It's been a labor of love. I believe it's taken quite a lot of work to put that together, and I'm super excited for the community to see that documentary that we have coming out.
So I'll add to your stigma our t-shirts that will be free this weekend. They're going to be right at the stigma. They have several people carrying a casket, and it says Narcan is not an enabler. It prevents funerals. It prevents funerals. And so we will be giving out free Narcan. We also have xylazine and fentanyl test kits that we will be giving away at the event this weekend. And for those that don't know, we have a harm reduction vending machine at the J Grand Mental Health. And it is outside, it's around back, and it has about 9 different items, everything from HIV test kits to Narcan, fentanyl, and xylazine test kits, condoms, pregnancy test, wound care kits, and all of that is available 24 hours a day, and it is free, and you don't have to talk to anybody. You just walk up outside and go to the vending machine.
And that's at the Grand Mental Health in
J. Mm-hmm. It's around the back. Yes.
So with that being said, and the stigma, we think we're small town America, and we're never going to be touched by that big city type of things, but we're seeing an uptick, aren't we?
Absolutely. Yeah, I think smaller towns are almost getting just as hit us, as hard as the bigger towns. As we were speaking off air earlier, I'm from Chota, and that's where I found my addiction. And that's, luckily where I ended up losing my addiction, but Doesn't matter where you're at, you know, because the big town like Tulsa's only, you know, less than an hour away. You're gonna get what you want, however you want it. And unfortunately, the fentanyl, the xylazine is now starting to trickle into the
It's
smaller
here.
communities.
It's here.
And
That gave me goosebumps.
yeah,
No.
it's taken a lot of friends and acquaintances over the past few years.
Absolutely.
It's extremely serious. I don't think people take it serious enough. You know, a lot of the party drugs and everything. There's nothing that's on the streets right now that's not contaminated. I'm comfortable in saying that
Absolutely.
probably 100% of street drugs is going to have xylazine or fentanyl in it. And there's always a gamble. You don't know if you're getting that little bitty crumb of fentanyl or you're getting a big chunk of it. It is never going to be the same consistency. It's always going to be up and down, left and right, and you don't know when that pill is your day.
Well, and that's what I think a lot of the thing is too. People think it's just it's the fake pills, but they're actually putting it in all the other drugs now as well. So it's not just the fentanyl and xylazine's not just in the counterfeit pills. It's in all the drugs.
Yeah, it's unfortunately from the drug dealer's standpoint, it's, you know, fentanyl and xylazine is a great selling point because it creates addiction immediately. So, you know, for what it may would take a few weeks of, you know, like the real opioids to get addicted nowadays, you can get addicted off that first one just because it's so powerful, so strong, and it lasts so long. So, yeah, I do not see it slowing down anytime soon.
No.
How many families have you worked with that is directly impacted by this situation?
Oh my gosh.
All of them.
All of them.
All of them?
Yes, yeah.
I personally,
Hundreds?
I know probably, I'm going to say 8 people that I personally knew that have passed away from an overdose in the last probably 2.5 years.
And they're locals.
Uh-huh.
Mm-hmm. Wow. This is scary stuff, guys.
Well, within like the Delaware, Craig, Ottawa County. Yes.
Area.
Mm-hmm.
Yeah, and with that number on the rise and the rise and the rise, we see all these professions that we've been talking about with the summit, you know, compassion fatigue may start to hit. You know, it comes and goes in waves, but that's why I think the summits like this, you know, we're not the only one having summits, but these summits are so important because it brings all these professions to the same room. You know, other law enforcement can talk to other law enforcement what's going on in their community, back and forth. And one of the speakers that we're bringing in is, there's an HBO documentary called Ernie and Joe Crisis Cops. And they were the very first mental health crisis response teams in the nation.
Okay.
And so we're going to have a short, just a small piece of the documentary, and they're going to actually be there to talk about the film, answer any questions law enforcement may have on how they can implement it in their community.
Mm-hmm.
So, like, if a law enforcement were to watch this film, like, I wouldn't even know how to begin to start that sort of outreach. Now you do.
And it's kind of a new thing, right? Like, this is really an adjustment in what we're used to in life that we used to live. And what a great way to inform the communities and the public as well as the professionals that's trying to help you guys get rid of this epidemic. Excellent, excellent. So with this documentary, where can people find it?
Well, the preview will be just a preview will be this weekend, and so it is not out there yet. So that's going to be the first showing, and it will just be short clips of the interviews, and then it will be on YouTube.
Okay.
Yes, so
Excellent.
we're
And
really excited.
it's going to be shown this weekend.
This weekend at the Recovery Resource Fair and Overdose Awareness Day event
Okay.
on Saturday, August 23rd, 6 to 9 at the J Community Center.
J Community Center.
Mm-hmm.
Oh wow.
Yeah, I had seen some of the questions that were asked throughout the documentary. It's going to be a powerful film.
Marcus was interviewed for the documentary.
I was, yeah. So,
Oh my.
yeah, just knowing how, like, all the different stories that are out there and who they've interviewed.
Very
it's going
powerful.
To be, yeah, it's going to be very powerful.
Wow. Well, this is phenomenal, guys. And I know that it's one of those jobs that are very rewarding, but I know it's very trying too. And you guys keep up the good work.
Thank you.
If the public wants to get a hold of you guys, what's a tidbit how they can get a hold of you?
The best way to get a hold of us, specifically, if you go to Recovery 918 on all the socials, Facebook, we get back within minutes on there, and that's where you can keep up to date on all the comings and goings, all the events we're going to be at, all the summit details, where to register.
I like it. Thank you guys
Thank you so much,
for
Rebecca.
your time, and keep up the hard work. And
Thank
I
you.
hope this was very helpful for everyone out there. Stay tuned.